while I'm on it, why don't I call on Dan Danner, who's NFIB? Is Dan still here? There he is. Dan?
Thank you. Thank you, Mr. President.
Give us the business perspective.
Well, I'm honored to be here representing small business. We do think that small business has a key role in this debate, and for them, cost is still the top issue. And we very much look forward to finding a solution together that works for America's job creators. So we appreciate being here, and thank you.
Good. One thing I want to talk about, just this whole cost issue. I can't emphasize this enough. There is a moral imperative to health care. I get 40,000 letters, I guess, every day here in the White House. I don't read all 40,000. But my staff selects 10 every single day that I read and try to respond to as many of them as possible. It's a way of staying in touch with the constituencies that I had a chance to meet during the course of the campaign. I can tell you that on average, out of the 10, at least 3 every single day relate to somebody who's having a health care crisis. Either it's a small business that's frustrated because they can't even insure themselves, much less their employees. It's a mom who's trying to figure out how to insure their child because they make a little bit too much money, so they don't qualify for S-chip in their state. Heartbreaking stories. So there is a moral component to this that we can't leave behind. Having said that, if we don't address costs, I don't care how heartfelt our efforts are, we will not get this done. If people think that we can simply take everybody who's not insured and load them up in a system where costs are out of control, it's not going to happen. We will run out of money. The federal government will be bankrupt. State governments will be bankrupt. So I hope everybody understands that for those of you who are passionate about universal coverage and making sure that the moral dimension of health care is dealt with, don't think that we can get that done without, excuse me, this is a health care forum, so I thought I'd, model what happens when you don't get enough sleep. Don't think that we can, that's right, I'm talking to you liberal bleeding hearts out there. Don't think that we can solve this problem without tackling costs. And that may make some in the progressive community uncomfortable, but it's got to be dealt with. And the flip side is what I would say to those who are obsessed with costs, and this goes to the issue of Medicare and Medicaid reform as well. I don't think it is a viable option as a means of controlling costs simply to throw seniors off the Medicare rolls, for example, or to prevent them from getting vital care that they need, which means we've got to balance heart and head as we move this process forward.